Lawmakers in the Ohio House voting today to pass an amendment that would place limits on orders passed by Ohio Department of Health Director Dr. Amy Acton. Measures now headed to the state Senate for consideration. News 5's Olivia Fecto reports there are strong opinions about whether this bill is even needed.
Lawmakers in the Ohio House split along party lines, with all the Republicans voting for the amendment and all the Democrats voting against it. The amendment to Senate Bill 1 would place limits on those ODH orders. After 14 days, they'd need approval by JCAR, the Joint Committee on Agency Rule Review, a 10-member panel of the General Assembly.
It balances the needs of our health with the need to remain constitutionally true to the legislative branch enacting legislation.
Is it a good idea? Is it a bad idea? We don't know because nobody's seen it and nobody's had an opportunity to weigh in on it.
Representative Bridget voted against this, saying it was a surprise amendment. She says the legislative process should be transparent.
These policies should be putting the people of Ohio first. It shouldn't be playing political games.
You have 1 million people unemployed. You have an epic abuse of power that caused all this unemployment.
Representative Becker says people in Ohio are demanding lawmakers do something to reopen the economy.
The bill is a step in the right direction, which is why I supported it, but it doesn't go near far enough.
But the amendment does not have an emergency clause, so if signed into law by the governor, it couldn't go into effect for 90 days. Becker introduced his own bill this week to make Dr. Acton's orders advisory rather than mandatory unless they're approved by the General Assembly.
It injects some politics into public health.
Representative Fred Strayhorn says the amendment is unnecessary.
If we see something that is out of whack or an overreach, we have the ability to convene as an entire body and address that specific thing.
He's worried the need for approval by JCAR could lead to delays or lapses in orders.
With a novel virus that's fast spreading, even delays of 3 or 4 days can lead to thousands of infections.
Governor Mike DeWine's office said the governor would veto both proposals to limit Dr. Acton's ability to issue statewide health orders if either makes it to his desk. Olivia Fecto, News 5.